Hi everyone, welcome to this 10-day series where we are discussing 5 clinical questions and 5 spotter images for NEET PG 2025, and today happens to be day 5. In case you've not seen the previous 4 videos, the links for the same are attached in the description below. So let us get going with the very first clinical question that we have over here, something that will help you in medicine as well, where we have a 54-year-old man who underwent a cardiac transplantation for a low output cardiac failure. Now there is an autopsy image that has been shown, so obviously this man did not survive, and the histopathology is further described to you, showing us that there is mild hypertrophic myocytes and there is mild fibrosis. On the basis of this, they've asked you for your diagnosis, and there is one negative thing written over here, that there is no myofiber disarray. Now that's actually the giveaway, because as soon as you see the autopsy picture, you can certainly see there is a normal heart given, and in comparison to the normal heart, I can see that all the 4 chambers seem to be dilated. On the basis of this, I think it is dilated cardiomyopathy. But then they said that histopathology shows mild hypertrophic myocytes, which everyone would think is hypertrophic cardiomyopathy. But I hope you've not forgotten that in hypertrophic, number one, the shape of the heart is going to be a banana shaped heart, which I do not see over here. And secondly, it's not just hypertrophy as the name suggests. Of course that's there, but along with that, all the fibers are also arranged in a helter-skelter manner. So fibers will be arranged in all opposite directions. So hypertrophic cardiomyopathy shows helter-skelter appearance, which is not written over here. They clearly write there is no myofiber disarray. So that tells me that dilated cardiomyopathy is just not dilation. It can show you a little bit of hypertrophy sometimes, but that doesn't make it hypertrophic cardiomyopathy. So now the take-home message is both DCM and HCM can show you hypertrophy of the cardiac fibers, but HCM will further show you the helter-skelter appearance or the myofiber disarray, which was not seen over here, and hence it's DCM. Now when I ask you the clinical questions, the most common cause of dilated cardiomyopathy is idiopathic, because in more than 50% cases we don't know the cause, but when we know the cause, the most common of them happens to be alcohol. If they ask you from the genetics point of view, running in the family, the most common gene mutation for DCM is going to be Titin. Of course, as I told you, from pathology point of view, there's going to be dilation of how many chambers? Of all the 4 chambers that are going to be dilated. So both atria, both ventricles. Along with that, I told you little bit of hypertrophy can be there, but please make sure that there is no disarray, because if disarray comes, then that becomes HCM. Now homework number 1, every time giving you 3 homework. So homework number 1 for the day is that in dilated cardiomyopathy, which is the kind of nucleus, an appearance which I've kind of given a hint over here, which is seen, which you will let me know as homework number 1. Let's move on to question number 2, which is from microbiology, asking you about a microscope that exposes the specimens to ultraviolet light and forms an image which is emitted at a different wavelength. What is this microscope called? The answer is known as fluorescence microscope, and I'll show you an image over here and get back to the question. This is a fluorescence microscope, but it looks exactly similar to a regular light microscope. What is the difference? I can see something extra attached, of course, and now let me go deep, dive inside what is in the inside. On the inside, I realize, like any other light microscope, this also has a light, but the light over here is not any other light. It is particularly a mercury lamp, which is going to have ultraviolet light. So that is point number 1, which was mentioned in the question also. Now, when ultraviolet light will start going, I realize that it is getting reflected by a mirror that I see over here, and this is referred to as the dichroic mirror. Now, that's not present in a light microscope, that's only in a fluorescent microscope, and the mirror will always reflect light. So what this mirror has done, this ultraviolet light has been reflected towards the specimen. Let's assume I have a specimen of TB over here, which is very common in our country. So on the specimen, if you clinically were suspecting TB, on this specimen of the patient, you should have added a certain dye, which are also known as fluorophores. Fluoro because you want them to shine. Like just asking you as an example, for TB, the fluorescent dye is going to be auramine and rhodamine. I hope you're not suggesting rhodanine over here, because rhodanine I've taught you is for copper in pathology. Rhodamine is for MTB. That's how we learnt it. Mycobacterium TB, rhodamine, whereas rhodanine is for copper. So what you've done, you've added some fluorescent stains over here. Now, as soon as this ultraviolet light will come and strike the sample and this fluorescent dye, the wavelength of the ultraviolet light will change. Initially, the ultraviolet light came on a shorter wavelength. So initially the wavelength over here was shorter, but after coming in contact with this sample, the wavelength that is going to go back and reach our eyes is going to be of a longer wavelength, and that's That's the principle of a fluorescent microscope. That's the light that comes to our eyes, and this is what you can view. Now read the question again. Number one, you're using ultraviolet light, which makes it fluorescent microscope. Secondly, you will see that the light that has been emitted is of a different wavelength. So shorter to longer wavelength further makes it a fluorescent microscope, something which is very, very important for your exams. Moving on to question number 3 over here, they are saying that what are the characteristic blue color bodies that are seen in the peripheral smear in patients of sideroblastic anemia. Today I've got a very good mixed bag of something of hemat also, something of pathology, systemic, little bit of general. So 5-7 questions that we have are going to actually make up a good diverse bag over here for you. So blue colored bodies, peripheral smear, you're talking about hemat, sideroblastic anemia. Sideroblastic anemia is a condition in which anemia is there due to excess amount of iron. Now excess amount of iron will always end up making bodies which are known as Pappenheimer bodies, which asks you a simple question: what are Pappenheimer bodies made up of? They're made up of iron. Let me show you an image. Now when usually I'm doing a hematology peripheral smear, I use the Romanovsky stains. Examples of Romanovsky stains happen to be Jimsa stain, Leishman stain. These are the usual Romanovsky family members with which you stain every hemat slide. If you look carefully inside the red blood cells, I can see multiple dots which are all the Pappenheimer bodies. And you are saying that Pappenheimer bodies are made up of iron. How do you prove it? Whenever you have to prove iron, you will be using a stain known as pearls or Prussian blue. So now the next image that I have, all those bodies, Prussian blue, all those bodies have become blue in color because yes, they were made up of iron, and finally their iron composition is proven. And where is this seen? This is seen on a peripheral smear of which anemia? Sideroblastic anemia, because sidro word tells me that iron is more. This is peripheral smear. What is happening in the bone marrow? Now just imagine, if the iron is more over here, then the bone marrow also must be having a lot of iron. So in the bone marrow, we get to see something classically known as ringed sideroblast. Read the word again. Blast. Blast means, I'm drawing it once for you. Blast over here is basically meaning that you're talking about a red blood cell, but in the bone marrow, in a blast, I will say red blood cell precursor. And I have studied that red blood cell doesn't have a nucleus, but the red blood cell precursor definitely has a nucleus. So can I say over here that the blast that I'm talking about is going to have a nucleus? I have drawn the nucleus. Now what is this blast? I have understood red blood cell precursor. Sidro will tell me iron. And I have noticed that iron is present around the nucleus. The iron is present in a perinuclear location. Is it trying to make a ring? Yes, now I know ringed sideroblast. So there is a criteria. Is it necessary that a full ring should be made? No, that is not necessary. They say that if at least 5 iron granules are there. So let us draw it once again. Let's assume 1, 2, 3, 4 and 5. If even 5 iron granules minimum are there and they are covering 1/3 of the nuclear circumference, so this is covering half, which is definitely ringed sideroblast. Even if 1/3 would have been covered, that is also a ringed sideroblast. So at least 5 granules, at least 1/3 of the nuclear circumference, that is a ringed sideroblast. That's the picture over here. Ma'am, why is the iron looking blue over here? Because again, you must have used the pearls or the Prussian blue stain for iron. I don't even have to count. Of course, there are many more than 5 granules and they are almost covering 3/4 of the circumference. I had studied even 1/4 is covered, that is ringed sideroblast. But as soon as they use the word blast, that is seen in the bone marrow. Why am I teaching you? Because here they asked you peripheral smear, and that is why my answer was Pappenheimer bodies. If they would have asked me bone marrow, finding of sideroblastic anemia, then my answer would have been ringed sideroblast. What about the other options? What is Heinz bodies? Now every question about Heinz body is that this is a body that you get to see in G6PD deficiency. What is it? G6PD is not working, so all the hemoglobin goes kharab, all the hemoglobin goes spoiled, that is denatured hemoglobin. So ma'am, when you were seeing other bodies, you were using these kind of stains, Romanovsky stains, because the hemoglobin was normal. Now when the hemoglobin has been denatured, I can't see them on Romanovsky stains. So they ask you a PYQ that Heinz body cannot be seen on Romanovsky stains. Which stain is Heinz body seen on? It is seen on crystal violet stain. So 3 questions, and that's all that they can ask you. Heinz bodies are made up of denatured hemoglobin. They are found in G6PD deficiency and they are going to be crystal violet positive. Now moving on to Howell-Jolly bodies. That's also a very important question. What are Howell-Jolly bodies? They are said to be DNA remnants and they are seen in B12 deficiency, that is megaloblastic anemia. Apart from that, they can also be seen in post-splenectomy patients. They are DNA remnants, that's Howell-Jolly. Over here, clear-cut answer was Pappenheimer. Moving on to question 4, again switching over to microbiology, where we have a group of E. coli based on its virulence properties and disease-causing mechanisms is most likely responsible for fever, abdominal pain and bloody diarrhea in a 24-year-old male, and they've got the exact strain for you. O157H7 serotype has been identified. So which of the following EC over here refers to E. coli? Which type of E. coli? So when it is causing O157H7, that is classical enterohemorrhagic E. coli. Please note enterohemorrhagic. Hemorrhagic will tell me it will cause something to do with hemorrhage. So it causes something known as hemolytic uremic syndrome. So H for S. So hemorrhagic E. coli causes hemolytic uremic syndrome. Obviously this is going to be hemolytic anemia, that is common. Then uremic tells me that there is going to be renal involvement. So one more thing that I have to remember is that the platelet count in these patients tends to go down, that is thrombocytopenia. You know, I've seen a lot of people learning this, that hemolytic uremic syndrome is learned as the triad of RAT. By RAT they basically mean R is for renal uremia, A is for hemolytic anemia, T is for thrombocytopenia. But I feel, how many mnemonics will you keep on learning? If you just look at the name of the disease, hemolytic uremic syndrome, you will know hemolytic anemia is there. Uremia obviously means there is renal involvement. The only extra thing that you have to learn is that the platelet count goes down. So now my question is, hemolytic uremic syndrome is caused by EHEC. Which strain of EHEC? It is caused by, if I have to write it, EHEC O157H7. That's the question that you get. So now I also have a question on all the different types of E. coli that can cause diarrhea. So you know it is E something E. coli. Only one alphabet changes. The E over here stands for entero. Then some alphabet in the center will change, and the last EC is E. coli. So everywhere it's E something E. coli, E something E. coli, or you can say entero something E. coli, entero something E. coli. So let's start. When I say entero P, P stands for P for pathogenic. So that is going to tell me about P for P, that is pediatric or infantile diarrhea. How easy? Enteropathogenic E. coli causes pediatric or infantile diarrhea, and it tends to show you AE lesions. This question was asked in a few years ago under INICET. So this you should be knowing as a PYQ. What is AE lesions? Attachment effacement lesions. If you look carefully, what are these finger-like projections in the intestine? Ma'am, these must be the villi, of course. And on top of the villi, can you see EPEC has come? First it came and attached, so attachment, and after that it is trying to spread out. So that is known as effacement. Attachment effacement lesion is seen with enteropathogenic E. coli. How I've learned it is pathogenic causes pediatric infantile diarrhea, and with peds or infants you tend to get very attached with kids. So attachment effacement lesion. Coming to the next, entero T, toxigenic E. coli. So T for T, toxigenic, is going to cause T for T, that is going to be traveler's diarrhea. Very simple, history of travel will be there. The next is EIEC, entero-invasive E. coli. If it is invading into our intestine, it will cause bloody diarrhea. Bloody diarrhea is known as dysentery, and not only is the name invasive and not only is it causing bloody diarrhea, it is also diagnosed by an invasive test called Serini test. How I have learned it is Serini test. So that Serini constantly reminds me that okay, this is to do with entero-invasive E. coli. Why is it invasive? Because Serini test, now although it's Serini test, but I am going to write it as Serini test, because that will tell me that okay, this is entero-invasive E. coli, and I can see that this is an animal test. You are injecting it in an animal, and the animal is having some keratoconjunctivitis. So this is invasive or an animal test. Coming to the next one is going to be entero-H, hemorrhagic E. coli, which I just now taught you, is causing hemolytic uremic syndrome. The strain is O157H7. What is the microbiology point for it? O157H7 is SMAC negative. What is SMAC? SMAC stands for MAC. I think all of you know, in earlier lectures we have studied, even in this 10 series we have studied McConkey agar. McConkey agar is usually for lactose fermentation. If I start using McConkey agar for knowing about sorbitol fermentation, then I will call it sorbitol McConkey. SMAC. Usually all the E. coli are going to cause sorbitol fermentation. All the E. colis, they cause sorbitol fermentation, so SMAC is going to be positive. But O157H7 does not cause sorbitol fermentation. So can I say that enterohemorrhagic E. coli or O157H7 is going to be SMAC negative? It does not cause sorbitol fermentation, and that is what is written over here. Coming to the last one, entero A for aggregative. Now whenever the bacteria will aggregate, firstly under the microbiology, it will aggregate as if there are stacks of bricks one on top of each other. So that is referred to as the stacked brick appearance. cells, they look stacked, and that stacking is seen on particular cell lines called Hep2 cell lines. And when they will stack, the kind of diarrhea that they will cause will be persistent diarrhea. What is the medicine definition of persistent diarrhea? Diarrhea lasting more than 14 days. Because they have aggregated, they are resulting in persistent diarrhea. So overall, as a revision, enteropathogenic E. coli causes pediatric diarrhea, toxigenic causes traveler's diarrhea, invasion causes bleeding, so dysentery, hemorrhagic causes hemolytic uremic syndrome, and aggregation causes persistent diarrhea. Going back, I was asked a question on 157H7, that is EHEC, and the answer over there. Moving on to question 5, which is a previous year INI set and NEET PG PYQ. Adequacy of pap smear on conventional pap. And the answer over here, how many epithelial cells should be present? I hope all of you went in for 8,000 epithelial cells, and that's the criteria that you have to follow. Whenever you are following the criteria of pap smear, this is basically the criteria that has been given by the Bethesda system. That is where all the scientists met and they decided, what criteria has to be followed. So in this, they decided that there are two types of pap smears. Either they are doing a conventional pap, which I showed you a few days back as an image, iris spatula, or they are doing liquid-based cytology. Whether they are doing conventional pap or liquid-based cytology, two types of cells you have to see. You are trying to look at the cervix, right? In the cervix, you have two types of cells. One are the epithelial cells, the squamous epithelial cells, and the other are endocervical cells. Even in liquid-based cytology, you should be seeing the epithelial cells and the endocervical cells. I notice in both of them, how many endocervical cells have been written over here for the adequacy. Whether you're doing a conventional pap or LBC, endocervical cells should be at least 10 in number. So that is the same. The change happens in the squamous epithelial cells. For conventional pap, it is 8K to 12K, 8,000 to 12,000 epithelial cells per 10 HiPA fields. And for liquid-based cytology, it is 5,000. So if I had to give a very small, shorter, a yellow slip that we used to stick in our notes and make it concise, for both of them, the endocervical cells that have to be there have to be at least 10. But the epithelial cells for conventional pap that we have is going to be 8K to 12K, and for liquid-based cytology, at least 5K. They asked you the adequacy criteria of epithelial cells for conventional pap. My answer is 8K to 12K. Now, when we've done this as a theory question of pap smear, let us now do the remaining 5 images of today, everything to do with pap smear. So let me actually ask you the first image-based question from a theory point of view. They will give you a 28-year-old female who comes to the clinic with complaints of vaginal discharge, which on colposcopic examination shows the following appearance that you can see. I hope all of you identified this to be the curdy white discharge, and based on curdy white, cur for cur, that becomes candida. They've asked you what would you see on a pap smear. So cur for cur, I would see the shish kebab appearance. So let us start reading this, that what is shish kebab. This is the exact picture, and this is exactly question 6 which I wanted to show you from point of view of image based question. Whenever you see a curdy white discharge and you start seeing something which is to do with shish kebab, you will start thinking of candida. So now how did we learn it in microbiology lectures from point of view of Shah Rukh Khan? That is how we became. So for candida, for curdy white discharge, for shish kebab effect. For those of you who love kebabs, I'm very sorry, this might stop you from eating them, because shish kebab effect is seen in candida. Now what is it? Candida is a fungus, as all of you know, and candida as a fungus is known to have pseudo hyphae. So these long sticks, the kebabs are always put on a stick. So that long stick is compared to a pseudo hyphae, and then those pieces of kebab that you have, those are the squamous epithelial cells of the cervix. So if you look carefully, there is a long stick that is going, that must be the pseudo hyphae, and all the epithelial cells that are attached on top of it, those happen to be the pieces of kebab. So shish kebab effect, candida. That was question 6. Now let's see if you can pick up question 7, which is again a pap smear. The first photo that I have is a colposcopic examination. The cervix is looking very angry looking cervix, because red color dots. That is to do with strawberry cervix. I hope you could identify this is a case of trichomonas. So first thing that you see over here is going to be the strawberry cervix, which is beautifully shown in this picture. The female always comes with a greenish color discharge. How we've learnt it is that whenever you will draw a strawberry, firstly the strawberry is how the strawberry cervix looks like, and on top of the strawberry there are green color leaves. So you will say the greenish color discharge happens. That is trichomonas. Now how does trichomonas look like? Either it is a pear-shaped organism or it is a kite-shaped organism. So if now you zoom into this picture, you will be able to notice that there is one organism from which some flagella or a thread thing is coming out. So that could be a pear-shaped organism. This over here is also looking like a pear-shaped organism. So pear-shaped organism is trichomonas. But now there's another question that, ma'am, anyone, especially an undergrad, can easily think of this to be some dirty blue material kept. I might not think it is trichomonas till the time you don't tell me strawberry cervix and greenish discharge. So now can I get a hint? Yes, trichomonas very commonly tends to occur with its best friend called leptothrix. What is leptothrix? It looks like these long threads. So whenever you start seeing long threads, which is leptothrix, you will have a hint that if leptothrix is there, then his best friend trichomonas also must be there. And then you will start searching and you will start seeing some round color trichomonas or round shaped trichomonas. This appearance of leptothrix and trichomonas together is known as spaghetti and meatball appearance. Spaghetti and meatball appearance means spaghetti pasta, so that is going to look long like the leptothrix, and meatball are round like pear shape or meatball, that is going to be trichomonas. So now your second homework for the day is that which fungal infection or which other infection can show you the spaghetti and meatball appearance. Homework number 2. Homework number 1 was which nuclear appearance in dilated cardiomyopathy. Homework number 2, where do you otherwise other than this see spaghetti meatball. Moving on to question 8 for the day. Another pap smear image for you, which is classical. You can't go into the gynae exam without knowing this. This is the classical bacterial vaginosis, which is also known to cause by a bacteria called Gardnerella vaginalis. So firstly, when they have bacterial vaginosis, the classical microscopic appearance, which is a part of the Amsel's criteria which you study in gynae, that should have clue cells. Now what are clue cells? They will give you a clue. If you see them, you will get a clue that, oh, this is bacterial vaginosis. So they are going to be the cells of the cervix only. On top of those cells, you will see the bacteria stuck. This bacteria, Gardnerella vaginalis, that's a cocobacillus, that is going to be stuck. So if you look carefully, this is a cell, but the cell is not looking clear. The cell has those bacteria stuck on it. So ma'am, why will the bacteria only sit on the cell? First, very good question. So when it is sitting on the cell, I've called it a clue cell, okay? But the bacteria would also want to go and settle in the background, right? So over here, if you see, this is a clue cell because the bacteria is on the cell. But if you look carefully in the background also, there is some dirty bacteria that is sitting. It looks as if the background is covered with a film, and that is known as filmy background. So please note, filmy background and clue cells are seen in bacterial vaginosis. Moving on to spotter number 9 for the day, and this is a classical, another pap smear image where you've got all this thready material coming out. A classical case of actinomyces, which is your homework number 3 for the day, that what must be the history of this patient and what kind of a device must be there in her uterus, which I think I've given the complete answer also, after which she is more prone to actinomyces. How does that's homework number 3, which you let me know. How does actinomyces look like under the microscope? It looks like these dhagas or threads, filamentous. After that, you can give it any name as per your imagination. Some people say they look like the threads of cotton, so they call it cotton ball. Some people say they look like the threads of wool, so they call it woolly ball. Some people say कि ma'am बिल्कुल कचरा, it looks like dust, nothing. Thus it's going to be dust bunnies. Some people want to give credit to the scientists, so they call it Gupta bodies. No matter what name is given over here, it is the same thing talking about actinomyces. Moving on to the 10th question over here, which we have, which again I think I've taught you in the previous 10 series also, but I still want to tell you and ask you which infection would this tell you on a pap smear. I've got you the corresponding biopsy also. It's the classical coelocyte, means we are talking about human papilloma virus, which we have studied in the previous second or third 10 on 10 series also. We did that. So how do you identify a coelocyte? Number 1, I will look at the nucleus. The nucleus will look very shriveled and dried up, just like a raisin. So there's a raisinoid nucleus, and around the nucleus, if you see, there is whitish. Usually, ma'am, the cytoplasm is pink. Here I can see the cytoplasm has been cleared around the nucleus. It has become white. So there is a perinuclear halo. Together, this is known as a coelocyte, which will tell you HPV infection has occurred. All infections of pap smears you have done in the 5 spotter images today, but I have a bonus question for all of you. Another pap smear, and what is the diagnosis of this? So these images that I taught you today are more important from gynae point of view. Many of you might have skipped it in the rapid revision of pathology while studying it, and that is why I got it over here, because this will help you a lot in gynae also. In FMG students, this will help you in paper 2. For NEET PG students, it's going to help you in all your integrated questions. So on a pap smear here, is this candida showing you shish kebab effect? No. Is it showing you trichomonas pear-shaped organism? No. Is it showing you coelocyte for HPV? No. Is it showing you those thread like actinomyces? No. This is not an infection. Over here, I can see something totally different. There is a cell which has a very big head and a very small thin tail, a cell with a big head and a thin tail. These are are known as tadpole cells. The big head is because of the nucleus, and the cytoplasm has made a tail over here. This tadpole cell does not tell you any infection. It tells you squamous cell carcinoma of the cervix. So on a pap smear was never a screening modality to know for infections. Pap smear in the cervix was to know for cancer, screen for cancers. And this is how squamous cell carcinoma looks like. That was your bonus image of the day, which also gets us to the end of this particular series or this particular session. And these are the three homeworks which I've got. Number one, you had to tell me the nucleus seen in DCM. Number two, which fungus shows you spaghetti meatball appearance. Number three, actinomyces will be seen clinically more in which kind of patients. So that of course is the end of day 5, and I will be meeting you now tomorrow with the next part of this series, that is day 6. I hope you're enjoying the series. I am following up very dedicatedly all the answers that you're posting, so please keep the answers coming. I mean, it's just a way of making you revise in these end days, and I'm looking forward to the answers to these 3 questions also. See you in the next series. Study well. God bless.